The topic of this research project is to understand how we can better engage patient partners and research participants from diverse backgrounds in BC. And our focus is on the perinatal period. So I think this research topic has always been important and relevant, and COVID-19 has just kind of highlighted that even more. We've been further limited in how we can identify, recruit, engage, and retain also research participants and patient partners. So I think we've actually really had to think a bit more creatively about how can we do this and how can we do it well. And it's opened up some new avenues and realized that maybe some we thought were difficult aren't as hard as we thought, but it's also put some new limitations on it. COVID has been an opportunity. Like, it's highlighted that digital engagement is possible for healthcare, for research. People will engage that way. Some people prefer to. And I think actually we recognize that there's some people who maybe couldn't engage as easily in person or written communication that are really more accessible in a digital format, from location, some with invisible disabilities, visible disabilities, having to transport. I think there's lots of opportunities. That being said, it still doesn't reach everyone equally. So I don't think it is a panacea. I wish it were, but I think, especially when we talk about income, education, there's a lot of people who are still left out. Also, connectivity issues in rural areas. So I think it has been an opportunity, but it's not a fix-all. The first is I think we're falling short, and I think that we could have better representation in perinatal research, and that it is our responsibility to do so. And I think that there are some barriers that can be identified fairly easily. Many of us know them already, and they can be addressed. So I think we're not doing good enough, and we can do better, I think is a key point. And I think there's still a long way to go. So my hope for this project is really to continue to raise the profile and make all of us, be it participants, community members, researchers, clinicians, think about who we're engaging with. Like, is this our patient population? If we're providing a new clinical intervention, who was this research developed on? Like, is it our whole population? Just really having a bit more. We're not going to reinvent the wheel overnight. We're not going to understand all the issues or solve them all, but we can certainly do better. It's a fabulous group of people from across UBC. We have a number in Vancouver campus and a number of new collaborators in the Okanagan campus, as well as collaborators from other institutions. We also have 3 super engaged patient partners, one of whom was with me in the health dialogue and is a researcher in her own right, who presented. So this project actually was a spin-off of another research project where we were recruiting patient partners and realized all these patient partners are the same, and they don't represent the population that we're hoping to access for our project to improve the health of. So how can they speak for patients if they don't look like the patients that we're looking for? So, we started speaking, me and my primary collaborator, Jenny Key, who's an anesthesiologist at UBC and St. Paul's Hospital. We started speaking with others in the field, recognizing many of us are encountering the same problem and running up against these same obstacles, but we hadn't all gotten our kind of heads around the same table to say, okay, this is an issue. Let's get some words on paper, get some data, start presenting it, start profiling this issue more broadly. And it's really expanded from there. A number of our collaborators were cold calls. So I looked through UBC to see who's doing this kind of work. And what do they do? And how do they solve this problem? Or is it a problem for them too? And I had an overwhelmingly positive response and people who were keen to be engaged. And so the team has kind of continued to grow from there. I was thrilled to see the attendance, the number of people, the diversity of people from different, like interdisciplinary, lots of people I knew, some of my patient partners who were even keen on participating, which is always nice to see. And as far as the discussion, I think a takeaway was we need to have more discussion about this, right? We need to share our experiences and what has worked well and what hasn't, and take the time. There's no easy fix. That's really, I think we often want an easy fix, but the answer is there's no one method. There's no one like button you can press. It's build the trust, take the time, know the people, diversify your team. And I think those messages can never be said too often. I think it's twofold. I hope to achieve some tangible, actionable strategies. So identify some barriers that, probably kind of those low-hanging fruit, things that maybe we're already doing, we could do better, some strategies we can suggest, recommend for ourselves and others to improve the way we go about health research. And then I also hope this can be a bit of a catalyst to those who attend these sessions or participate in the survey to take on some of these strategies that are more long-term about building trust, building diverse research teams, the importance of thinking about who our patient partners and research participants are. So I see this as the first mini step in a long journey for many people, but I also hope we get some tangible nuggets out of it that we can apply in the short term.